have the reports from each session, from the breakout session on scaling and sustainability. I want to invite now the first report from Group A. That was the results-based financing. Okay, you want to come?
Buenas tardes, voy a hablar en castellano. A mí me tocó...
I will have to talk about the challenge, and I have to talk about our debate that has been a very fruitful debate. We have agreed that in the past years we are facing an ever-growing cultural change in terms of how we manage public resources in comparison to how we managed them in the past. This change, nevertheless, sets forth opportunities and challenges. Opportunities, first and foremost, because these resources would be targeted to people's interest, because in this way we would outline our budgets, and budgets have as a purpose to try to change some type of problem or interest that affect citizens, like nutrition, education problems regarding violence, and this is why we consider it an opportunity. It's also an opportunity because it could be considered as mechanisms to empower people, because if people can participate of these processes of information generation, they will have better knowledge of the problems that are connected to different issues, and they will be able to exercise actions in order to change the situation. Nevertheless, as everything we have also pointed out that there are challenges here. I will talk about 3 challenges, although we have more challenges. Number one, that this is a very demanding process in terms of information, and we do know that not in all countries we have information systems that are necessary in order to give support to a process to create budgets based on information. So therefore, we have a challenge before us in terms of how to improve information systems that currently exist. On the other hand, we also have debated a challenge because this culture targeted to result is present in the public center, and it's not present in all private sectors. In both cases, in both places, we still have practices that not necessarily are geared toward results, but they are based on ideological positions, political ideologies, or other types of situations. Therefore, there is a challenge in terms of disseminating this methodology in the public sector, but in the private sectors where we have many differences. In terms of information, another issue that we debated was, in a number of countries, this methodology has come like a concern only based on results, and in these terms, I believe that we should especially see the impact assessments. But in reality, as important as this, and mainly when we talk about childhood, where the impact isn't necessarily in the short term but more on the medium and long term, as important as this, it is to think and to try to document correctly something that we call change theories. change theories. That is something that still hasn't been strongly deployed or included in our society, some more and some less. And to think also in the intermediary results as our progress toward this impact assessment. We believe that this would give a more balanced image to a procedure, as I mentioned, not necessarily has to be concerned on impact assessment, but has to be concerned on the processes of intermediary results and everything that is associated in terms of change processes. Well, and finally, we also debated the innovation because, well, at the end of the line, as we have not much evidence available, how to innovate is a question that we are still posing to ourselves, and we haven't answered it. Although within our group, a number of people mentioned that in a number of countries, they were already seeking to institutionalize the generation of pilot experiments that would be like small efforts in order to start generating information that subsequently will be used in order to back up programs that have greater reach. So this is basically what I could share with you. Thank you very much. Tenemos 5 minutos para que planteen sus preguntas.
Do we have any questions or comments from someone that was in the session? Okay, if we don't have questions or comments, we're going to move on. Okay. Group B, measurement and indicators. I'm going to invite now the report, please.
Thank you. I'm Mark Miller from the National Institutes of Health, and I'm pleased to report a very productive group that started off on discussions of what are the relevant outcomes that need to be measured, and measuring outcomes from a population or individual perspective. And we first went through the different types of in-process indicators or indicators of outcomes. The first being actually process indicators, measuring inputs and outputs, whether or not they be management-related process indicators for improvement of those indicators, of logistics and operations of services, looking at investment indicators from various different perspectives of local community versus the national, and not only investment indicators of financial, but also time at the individual localized level in the household. The second type of outcome would be looking at knowledge, attitude, and practice indicators. The third type would be the very specific tools, technical tools for the individual measurements and the population-based measures. And then finally, another indicator is the coverage of the actual services, for example, for sub or marginalized populations. We then discussed, or actually presented to us, first by Marta Rubio Codina from the Inter-American Bank, some of the initiatives that have been going on in the region, looking at three initiatives that have been undergoing in Bogota, looking at the measurement of childhood outcomes. The current measures are relatively expensive, and can there be other measures that could act as a proxy, lower cost for those measures? So they enrolled 1,300 children in lower and middle income households, and to look at those outcome indicators versus the Bailey's tests and other tools to do comparisons in various different ages and various different domains. And the work is still ongoing, but so far that the more elements you have, the better the tool is. However, it's also more costly. So the question is, what's the optimal level of an instrument that could be potentially developed that's most cost effective? So the results are still pending on that. They're also looking at the assessment of quality of childhood centers, which are population-based. And finally, looking at different tools to develop, which are easy and quick quality indicators, potentially for policymakers, and all of that work is forthcoming. We then had a presentation by Amy Verdisco from the Inter-American Development Bank, which was also looking at some regional instruments. About 10 years ago, when there was much talk about childhood education by ministers of education and national policymakers, there were no real metrics that people can hang their hat on and for measures. So over the course of the last 10 years, there has been development of a number of new instruments which have been validated in Latin America across 4 different countries, Costa Rica, Nicaragua, Paraguay, and Peru. And it has led to South-South dialogues for looking at some of these child development measures. And that's a major process that has been ongoing, looking at population-based measures, as well as cultural adaptation for national representational samples. 4 domains are being measured: cognition, language and communication, social, emotional, and motor in 24 to 59 months. And there are some very interesting preliminary findings that have come out that some of the traditional discriminators, such as urban versus rural and maternal education, is not being found to be discriminating. However, SES is. And nurturing is a major discriminator that has been found as well. We then heard from Maureen Samnes-Vaughan talking about the Jamaican national programs. And Jamaica historically did not really have any systems which were measuring educational outcomes at the youngest age. The health sector had many outcome measures, but not education. So they introduced a number of different measures looking at screening questionnaires through parents, population-based surveys working with the statistical and demographic factors, and also instituting research-level data, looking at birth cohort from 2011, enrolling 5,000 enrollees prenatally, 9,000 mothers at birth, and also enrolling fathers and looking at educational outcomes as well. There was a comment about the adaptation of Bailey's, MacArthur's, and infant temperament scales across 8 different populations that have been validated and tested. And overall, there's been considerable progress that has been made in all of these particular measures. I'm getting the signal that my time is out, but it was a very rich discussion. I'll just finish very quickly. There was some final questions about the connection between some of these early childhood outcomes and long-term outcomes, whether or not these were actual predictors of the future. And there was an example of a study that was done that looked at micronutrients. I think it was in, I can't remember, Malaysia, or a population that found that wasn't micronutrients as much as other environmental factors that were important at early age that were more predictive of later outcomes. And finally, there was a discussion about looking at resilience type of factors. Thank you.
Any questions or comments? No volunteers? All right, let's move on. Let's now have the session C, methodology of measuring public investments in young children.
Bueno, muchas gracias. En esta sesión sobre metodología.
Methodologies. I would like to introduce myself. I am Javier Curcio, and I work as a consultant for UNICEF, and I am a researcher in the University of Buenos Aires and the National University General Sarmiento in Argentina. In this session regarding methodologies for measuring social investment for early childhood, we debated an exercise that is being deployed in Latin America in 9 countries. in a first stage within a system for early childhood that incorporates other components that are related to problems of early childhood, with policies created by the state to respond to these problems, and the rules and judicial arena where these policies are based on. But till the moment, this system does not have a branch connected to social investment. Therefore, this component complements the system with states' financial investment and to try to resolve these problems and to guarantee the fulfillment of the rights of early childhood. We talked about 6 variable. What is the methodology that is being implemented? This is a process that is being deployed that we expect to complete it by the end of this year, next month. These variables are the cohort of early childhood. This would be between 0 and 7 years of age, so up to 7 years of age, including the concern on maternal and child situation. This goes from conception until the child is 8. The second variable was judicial coverage, where we try to incorporate actions of all the states in different government levels. Number 3, we had the registration base, where what is realized is the best indicator that shows us what the state does in terms of public policies in each period. Number 4, we have the universe where we analyze all of these policies, defining what is a functional universe and which corresponds to this prospect, basically social services in addition to other activities that are not within the social purpose but that are related to this and are related to justice, protection of rights, and birth registration and documentation of identity, because they have the right to identity. 5, we have how we classify these innovations and these expenses through 2 criteria. One is specificities, that shows 5 classes of expensive and how we can classify these different actions in terms of financial strength from the least and most specific and how they impact on early childhood. And the other form of classification that complements the first part, this would be functional classification that is related to the different functions that encompass social purpose. Here we see education, health, housing, water, sanitation, different social service that the state provides in their regulation, and they provide financing. And the 6th variable in terms of analysis and how often this happens. Here we're working with the last fiscal year, that is the year 2013, and other previous periods, depending on the availability of each country. And of course, we want to create dynamic to this action and going toward a process that can be institutionalized and can be brought in year after year. The debates that this session created were regarding a number of comments, some of which are connected to the need of making comparisons between different countries, what we do in terms of demands, what this age group demands are in each one of the countries, and the responses that countries generate from the fiscal and financial point of view. Also, the need to give sustainability to this process, to institutionalize it, and to approach this made by agencies and academia, to give it to the managers of the public sectors and give it to the representatives of the state of each country so they can deploy it. The importance to create applicability mechanisms that are more versatile, that could apply this to different jurisdictions that are interested in working with these schematics. Therefore, a robust methodology in order to make progress in comparison, but it has to be versatile to be able to apply it in other countries that have different situations. So the need to be able to neutralize interferences that cycles, that catastrophes, that accidents cause, because sometimes this can generate, for example, problems. Sometimes we have problems like drought in Sao Paulo, or you have, for example, floods in other areas, to try to minimize these effects so they can be leveled and to be able to broaden the schematic. Now also, the gaps, the existing gaps in terms of transversality from the age group point of view and different sectors and government levels, the need to complete and to structure what each one of the government levels does in each country, which corresponds to what sector, and how we can coordinate these transversal situation and how the policies of age group can be articulated with other social policies. Thank you very much. ¿Alguna?
I have a comment. I'm going to volunteer. I told you, Javier, I told Javier that more or less 3 years ago, we tried to do this here in Brazil, Fundação Maria Cília Souto Vidigal, to map how was the spending on early childhood development in the federal level, and it was a really hard and really hard challenge, and we hire a consultancy or an NGO actually called Contas Abertas, Open Accounts, and they know very well the federal budget, but they were not able to map because the money is always mixed with other things. There is no money directly linked to early childhood development. That it's very clear. And national network for early childhood that Luzia is here, the secretary is here, they're trying again with this challenge again. And I think you already are in contact with them because it's pretty interesting. I know that Brazil is not in your list, but maybe we can see if we can this year succeed or next year succeed in this challenge. There is a comment in the back. And one here also.
I just, hello? I just would like to say that just in this moment, we have a working group in health ministry studying this. I think it would be very interesting. There's a lot of, there's a group in the health, World Health Organization that is trying to get this information of the countries. So we are studying that a methodology to be able to select all the costs, all the investments in children's health to be able to get this information.
Thank you. Constanza?
Sí, yo quisiera también sobre este punto hablar de como el tema específico de Colombia, ahora sí en este caso, en las dificultades que nosotros también tenemos para avanzar, digamos, en el consolidado.
Progress in the consolidation to identify which sources exist in order to see these different attention or the total amount of this funding. In our case, as what we set forth was a structure, because what are we funding here? So knowing that we have so much diversity in the country, to understand what encompassing attention would be for each child. There are some that are very generic, very universal, but there are some that are particular, like in the case of the policies of each country. We, for example, in the case of Colombia, especially speaking, health, receives a package of attention. They're not specific for population below 6 years, and they have created a number of analyses with the support of the IDB, and now we're finalizing a new review of funding. But what we have realized that this is not going to be easy to dialogue with other countries, because this is very particular to our pathway. I believe the challenge would be to identify variables that would be generalized in the region in order to do it in a comparative way amongst countries and to monitor social and public expenses. Thank you very much. Yes, we were exchanging ideas with someone from the National Network of Early Childhood until what point it is possible to dialogue with Brazil with a methodology that they want to apply in the region. We want to make progress. We have contacts, and I hope we have good news in the brief period of time to give contributions regarding to what Constanza said regarding the Colombian situation. If I properly understood what you carried out and what you do in Argentina, we have similar exercises through Nacer Plan that grants certain coverage in the first years of life. It would be 0 to 6 years. This is the necessary cost to give coverage to health problems. This exercise is a different exercise because what it does, it monitors and it analyzes what has already been done. It really doesn't matter that the past isn't important. From this point of view, we don't see if what was done past was enough or not. No, this is just a constant view of the offer from the financial point of view. What financial effort did our countries do to see problems related to early childhood? And this is an input necessary for this funding. The IDB person said that they are concerned for funding these gaps. We carried out an exercise on the water and sanitation gaps in different countries of the region. These were brief exercises and connected to society by and large, and not only childhood. If you see what the state does and you know what you need, you can apply a management model. You can identify what the gaps are. But this is a previous step. We are only identify what is being done to improve the situation of pregnant women. What are we doing in the nutritional terms for early childhood? Here we see parenting, etc. So with this input, we can make progress toward another situation that is much more complex in order to bridge the gap and to have better public offerings.
If you have any further comments, all the speakers are going to be around. I'm going to now ask the speakers to return to their seats. We're going to close this session, and I'm going to invite now Constanza Alarcón. I think you know her, but I'm going to she's working for the presidency of the Republic of Colombia. And she's also the workshop co-chair with me here. And she's going to do the final remarks for us.